This is a novel technology that tested the hypothesis that we can detect broad field effects around known cancers with the idea that we can improve our ability to detect early cancers. In this notion of field effect, there is a general feeling that cancers produce changes in the normal appearing tissue around them that can be detectable even if not visible to the naked eye or through an endoscope. In particular, cancers are known to secrete substances that increase blood flow to supply nutrients and oxygen to the tumor. We know this process called angiogenesis, but it's likely more broad than simple angiogenesis. Pancreatic cancer has been particularly difficult to manage. As you know, more than 95% of patients who present with pancreas cancer are not curable at the time of presentation. So there's a major effort to improve our ability to detect early pancreas cancer. We took advantage of this field effect theory to see if we could detect early changes in the duodenum in patients with pancreas cancer in comparison to normal controls. This was a pilot feasibility study in 29 patients, 14 of whom had known pancreas cancer, and 15 were patients who were undergoing upper endoscopy for other reasons, but were known not to have pancreas cancer. Polarization gating spectroscopy is a technique where we measure the light absorption, reflection, and light scattering in the duodenal mucosa. The technique involves passing a small fiber optic probe through the normal endoscope and taking measurements from the duodenum. We then analyze the data looking at two specific parameters: the blood vessel radius, with the idea that blood vessels are dilated through the angiogenic effect, and also the ratio of oxy and deoxyhemoglobin, with the idea that tumors extract a higher proportion of oxygen due to their high metabolic demands. And we specifically had the notion that tumors would be associated with enlargement of the surrounding blood vessels and higher deoxyhemoglobin because of oxygen extraction. And in fact, the hypothesis that we proposed was found to be true. In the study, we found significantly higher proportions of deoxyhemoglobin in cancer patients compared to non-cancer patients or normal controls. We also found significantly higher blood vessel radius in cancer patients compared to normal controls. Overall, we found this study to provide compelling preliminary data that suggests that there are broad field effects around known cancers that can be measured remote from the tumor. In this case, pancreas cancers producing changes in otherwise normal appearing duodenal mucosa. We hope to extend this study further with a large prospective multi-center trial currently underway, and if that proves to be also accurate, that this study can provide part of a new armamentarium for pancreatic cancer screening.